Next is about we'll talk about the gadolinium based contrast agent and then the linear versus the macrocyclic one. I'm not going into much more details of the things, but there are various linear versus the macrocyclic agents in the market. I just start with little bit basics about the gadolinium. I think it's one of the metal which is found to be having intense imaging properties. And but initially the era has started with the linear, and over the period of time we moved to the macrocyclic. I think our experts they know that how the era has changed the world. I mean, from the linear one and the macrocyclic one. In the US, there was a lot of things that a lot of side effects or NSF cases or brain hypersensitivity cases were seen when we have compared the linear versus the macrocyclic. So gadolinium, what is the effect? Why it is toxic? The major, I'm not going to remember much of the details is the same, but it blocks our calcium channels. I was reading in the papers that it was saying that the gadolinium also interact with some of the important biological processes in our body, and it impacts, and so it is very toxic. It should not be moving in free in the body. Whenever any of the EM waves goes inside the body, our protons, they start displacing from one place to another place. So for getting them back, we want to have that getting them back to the proper place. Once they are displaced, at that time we'll have the T2 relaxivity, and once they just come back, it is T1. So we are taking the T1 pictures, which will give us the intense pictures, better images once it is back. But the concept lies in the fact that gadolinium should not be free. If it is free, it is interacting with the calcium agent. It is also impacting the other important biological processes in our body. So it has to be structured, it has to be caged, it has to be chillate. So either you have to do the chillating like a linear means as we used to do in our mathematics, linear equations, simple, straight one. Whereas a macrocyclic means you are just putting it in the cycle form or in the structural form. And when you are putting the gadolinium in the structured form, that means what you are doing, you are making that particular structure as a more stable. Living in a hut or living in a villa. So both of the things you see, in which of the things you will find it to be more safer and secure. That means you are living in a villa with the full, all amenities and everything into the same. So that's what it is, that it is less toxic when it is macrocyclic as compared to the linear one. Reduce proton binding, and as well as improve tolerance. So when it is macrocyclic part, then the kinetic stability part increases. Stability increases, that means the gadolinium will not come outside from that macrocyclic structure. If it is more of that is called the kinetic stability, it will not become toxic, even though it will give the good images over the period of time. Thermodynamic stability, ionic versus non-ionic. If it is ionic, that means it is negatively charged. If it is negatively charged, it will not interact with the proton ions, and the negative and negative, it will not interact with each other. Most of our cells, they are negatively charged, so it will not move inside the same. So thermodynamic stability means for the ionic cases, it will not break. It will be more stable at a different pH. It is negatively charged, whereas the neutral ones will be non-ionic ones, and they will be less stable as compared to the ionic one. So higher stability of gadolinic acid minimizes the risk of the gadolinium, and chelation always helps, transmetallation always helps, and it is more resistant to transmetallation, which is none other than when the gadolinium just breaks and comes out of its form, then it is, and it becomes toxic, then it is called the transmetallation. So chances of transmetallation, they are far less with gadolinic acid 0.5 with the macrocyclic agent basically. So when we have formed this, so if it is not in the toxic form, there will be lesser cases of NSF, and also there will be lesser brain hypersensitivity signals will be lesser. So how I learned this ionic linear MMOODGP. So I formed this ionic versus non-ionic, linear versus macrocyclic. When you see the dotatum or the gadolinic acid falls in the case of ionic and macrocyclic, that means it is kinetically as well as thermodynamically stable molecule. And there were no NSF cases and brain signals were seen. So inert molecule, highly soluble, high hydrophobicity, as well as it's been unchanged by glomerular filtration, no biotransformation, to do not cross the blood-brain barrier. So that's why the lesser of the brain hypersensitivity is a little lesser. And excretion half-life is about 1.5 hours and no specific drug interactions. So PK/PD parameters are quite safe. Then I just discussed that it will not pass the blood-brain barrier, and it is very safe in this sense because of ionic and macrocyclic ionic character. It will not. The negative ones are those molecules that are very difficult to pass from all the cells. So there is lesser, and also excretion rate is also a little bit delayed when we talk about the gadolinium acid. The half-life is more, but when we see, even though the question arises that even though there's so much of the half-life, but is it safe for the renal impaired patient? Yes, it is safe. We have done the study, secure study and rescue study, which I'm going to talk about in my next slide, which talks about rescue, that even though they have CKD 3 and 4 also, they are used compared with contrast and without contrast. So it was seen that even with contrast and without contrast, the results are seen to be almost comparable. So that's why we don't have never, even though so much of dosages encountered with gadolinium acid, still we haven't seen a single case of NSF. Even if they have been ranged from pediatric to adult to across the ranges. So good safety profile, very no evidence of nephrotoxicity, which I said, no cardiac issues are seen, and ranging age from few weeks neonates to the adults of 1 to 3 years. So renal safety, which I was talking about, even it was tried in the GFR, EGFR less than 20, and particular caution, as you guys are experts. So, but we have seen that that it is even with the lesser of the EGFR, it was tried and it's 3 and 4 range. In our study, it was not, and 3-month follow-up was also seen, and it is seen that gadolinium acid was not responsible for any of the contrast-induced nephropathy. And this study which I was talking about, that they have seen how much is the serum creatinine rise over the period of 72 hours, and it is 25% with the per target, and as well as EGFR values also, they just analyzed with both of the control groups without contrast and with contrast. And it was approximately 114 patients in which they have been split it equally in both of these scenarios. Yeah. So that it is not much seen, and it resulted in PS to be safe, and there are no NSF cases. Still now we have not seen any of the NSF cases when gadolinium acid was used. Last secure study, which not only done in the case of the CKD patients, but also it was done across the ranges, across the ages, to see if there are any safety issues with gadolinium acid or not. But they have seen and it's a huge data, and it's a 5-year study of 35,499 patients, which talks about that the goal was to see the safety among the different age group, different set, and they have done MRI in different scenarios like renal, cardiac, and many of the indications was done. And what they could able to see that the efficacy was superb, that 99% of the good images were seen, and there were no such safety-related concerns were seen when the gadolinium acid was used in this set of patients. Almost safe. See, the 0.1% of adverse events, and even though the adverse events were transient and quite manageable, and no NSF cases, and efficacy was 99% of the MRI images. So that is it. It's a safe agent, and it's quite stable, safe, without NSF and without any brain hypersensitivity issues. That is from my side. Thank you so much.